wonderful breakout sessions.
Thank you.
Thank you, Ayumi. What a pleasure it is to be here, and what an inspiring, event altogether, but specifically this last contribution here. What a show of resilience, courage, and perseverance we've just heard. And so we've just heard about the how, and Frank and I are here a little bit more to talk to you about a possible what, really. And indeed, what Amy was just saying, we're going to talk to you a little bit about digital health, and why we thought it would be nice to bring it up is that it's a very hot topic these days, and that really a one that presents many, many exciting opportunities, we feel, for women in technology. So digital health really is something that was growing quite a bit before we got hit by the pandemic. But really the crisis catalyzed years of change and adoption in just a few months. It was pretty amazing what we saw happen. And in fact, COVID-19 has been coined as the digital pandemic, a very appropriate word. As we all know, as we were confined to stay home, our world went virtual and digital, and we learned how to work, how to study, and even how to seek healthcare in a virtual or digital manner. And the practice of telemedicine, for example, grew more in a few months than it had in 10 years. Just in France, there was on average usually about 40,000 teleconsultations every month. And within 1 month, it grew to 4.4 million teleconsultations. That was just in the month of April 2020. So a literal explosion of that. And this wasn't just observed in France. We saw this in China, in the UK, in the US. You saw numbers register of plus 500%, plus 900%. So fairly astounding. And there was also an explosion of tools to track, trace, and analyze the virus. Over 50 countries have been leveraging data-driven tracking for forecasting and response initiatives, really for COVID-19. And to give you another number, just to get a sense of the opportunity in this field, the digital health market was valued around 220 billion back in 2021, and it's expected to grow to 550 billion by 2027. So we're really in an exponential curve in terms of expansion. So the growth in investments just between 2018 and 2021 was $44 billion. So my name is Florence Gaudry-Perkins, as Ayumi mentioned, and I founded Digital Health Partnerships, which is the name of my company. It's a boutique consulting firm that is dedicated to improving healthcare, specifically in lower and middle income countries. That has been my focus for years. And I'm thrilled that Franck Le Meur is with me today, and you will see that he and I bring very complementary sort of experiences and expertise, because whereas I'm focused on the developing and emerging world, Frank comes with a perspective of more advanced economies, really. So Frank, thanks for being with us today. And you founded TechToMed about 4 years ago, so it's also a fairly recent startup or firm, and you founded this after 25 years in the pharma industry. So can you tell us a little bit about your story and what led you to create TechToMed?
Thank you, Florence. First, I really would like to thank you very much for your invitation, and I'm very honored to be invited in this Women in Tech event. I am a pharmacist. I have been working for 25 years in pharmaceutical industry in several countries, several activities, and I had in my career a little window about technology in health, e-health. It was at the beginning. I was like a pioneer creating the first department of e-health in my company, and we were looking for opportunities to help patients to have a better understanding of their disease, but also a better control of their disease. And it was in diabetes and in heart failure at first. I did quit my company because I was thinking that there was a big opportunity, and it was before COVID also, a crisis, that there was an opportunity of the convergence between the health, which is a huge need for all the population and human beings, and the fact that there was this wave of technology bringing a lot of possibilities and solutions for health challenge. And based on this idea of convergence, I did create TechToMed, it could be made to take also. But it was the idea to merge those two worlds because, you know, health is very conservative, it's very private, it's very sensitive, and most of the time you have this wave of technology that is very huge and very fast with blockchain, Bitcoin, IA, etc. So it was very important to make those two worlds coming around. So my company is about providing some services, about consulting, about training, because we have thousands of people that want to know more how to use technology in health. So I have to play with doctors, but also with tech engineers. So we try to build some training session to help them to have a better understanding of what is the potential of technology. And we do also events. We have created several events in France with European people. The next one will be in July the 5th about digital therapeutics. You know, this is a way to treat people with only digital solution. And we do address finally the health tech agenda, which is very important. You have to know that patients today in their pathway, in their journey, they use a lot of technology. First to know, they do Google. Google is the first doctor for patients today. So there is now a real digital journey for patients. So all companies of all industry, all startup really have to address this fact. And the COVID crisis, I just accelerated this as leapfrog, I think, 8 to 10 years in way to innovate with tech in health. You have biology, application, IA, 3D printing, you know, in hospital. So there was a lot of acceleration that we have seen. And that's it. And I think that you, Florence, you're also involved in digital health since years, so you can also present your background, history.
Yeah, my passion for this field grew when I was actually in the tech world. I used to work with Alcatel-Lucent Nokia, and as international director of government affairs, actually. And back in 2010, I was not from the technology world. I'm not an engineer, and I uncovered then on my desk every morning what we coined as the mobile revolution. So I was getting statistics every morning on this absolutely stupendous penetration of mobile phones in some of the poorest areas of our world. So at the time I thought, oh my God, the world is about to turn upside down because these smartphones, which are actually extremely powerful computers, are sitting in the pockets already of some people who have not had the privilege of access to education and health, etc. And I got really excited about this. And it took me a little while to figure out because there's a lot of applications and things that you could do with those phones. And I was doing mobile agriculture, mobile education, mobile, health. And then I thought, well, I really don't want to just talk about this. I want to do something concrete. So I ended up focusing and deciding to focus on mobile health. And then from there, sort of started an adventure of trying to build what you call a social innovation or shared value strategy within this big corporation, which was quite fun and quite a challenge as well, which was the juncture of profit and social at the time. The trend was starting, and ended up actually building some mobile health multi-stakeholder partnerships in Senegal and in Mexico, breaking down silos between Ministry of ICT, Ministry of Health, private sector, and it was and those projects ended up scaling. So that was the beginning of my adventure in digital health. And over the years, it became much more complex. Entered the world of data, the world of AI and sensors, and on, and you name some of those applications. What I wanted to say is that somebody and a few people I think mentioned already today that it's not the technology is just a tool. And what drives me about this, and this is why I've chosen specifically to work with lower and middle income countries, is what it can do, right? It can reduce inequalities. And in the case, of course, of health, what really interests me in this is the access that it gives, right? If you take sub-Saharan Africa, for example, there are only 2 doctors on average for 10,000 people. If you compare that to Europe, it's about 32 doctors for 10,000 people. So there's a true access issue, right? Not enough infrastructure, not enough health workers in these areas. And the technology, therefore, takes all its meaning in areas like this in the world. And that's what's got me really passionate. Beyond that, I think what has always fascinated me is what you call the frugal innovation coming out of these countries. And I always take the old example of mobile banking. We all know mobile banking is more present. Africa is way ahead of the rest of the world in mobile banking. And the way that got started was exactly what I was talking about, 2010, the mobile revolution. And M-Pesa in Kenya, well, you know why it developed there? It's 85% of people in Kenya at the time were unbanked. Okay, so it's the same in health, and you're seeing unbelievable innovations actually coming out of this country, sometimes way ahead of our advanced countries. And many of you probably know the example of the drones delivering blood in Rwanda, because that created a lot of noise. But this originally was a US company that had a very difficult time developing this, because it's very complicated regulation between aviation, telecom, and health. So before you break down the barriers between those 3 regulators, it's not easy. But in these countries, sometimes you can overcome some of these barriers, because oftentimes it's a question of life and death. It's not a question of reducing costs, creating more efficiencies, or for convenience purposes. It's truly, it can save lives. And so that's what brought me to basically create DHP in 2016. So again, we serve lower and middle income countries. That's our specialty. And basically work with NGOs and foundations and also corporations and institutions and governments, and to further the cause. And Franck, let me ask you what you think. We've talked about this explosion during COVID. We saw many laws even sort of get moved and barriers removed during COVID in order to enable, many of these innovations to serve us while we were confined. Do you think this is here to stay? What do you see in the future?
I think that we have to project beyond the COVID, because health challenges are very deep. You mentioned access, you mentioned quality of care, you mentioned education. I think that we see, for example, in Europe, but also in France, that we are maybe facing the biggest crisis ever. Just know that in France, after the COVID crisis, we have lost 120,000 HCPs in our system. They do quit for change of countries. They do quit because they were, from some of them, in burnout. So we are facing a decreasing of the offer of health and the quality of health care systems. And we are also facing, on the other side, a demand of cure and care that is exploding. The population is getting older, mainly in Europe. So we have more chronic disease, etc. So I think beyond the COVID crisis, that it stressed very hard way our system. We all know that we have to find sustainable solution to solve our health systems in challenge. So we have the example of France with what has been done by the President Macron in 2017 when he arrived. He has put in place a digital roadmap for health, trying to really address new solution in terms of patient pathway, efficiency, education, data-driven health. So you have in this roadmap an obligation for example, for HCP to practice more and more digital tools, teleconsultation, telemedicine, tele-expertise, etc., telemonitoring now. And also, he has built also what we have in France, the Health Data Hub, which is an example for the whole Europe, We are going to have this big data health to help to do more R&D, but also to have a better system efficiency in terms of learns and new practice. And so you have also new authorizations for innovation. Example, now we consider that we can be treated or patient can be managed by digital solutions. You know that the COVID crisis bring a lot of apps in terms of people management with the disease. But now we see that we have the era of digital therapeutics that are most of the time in standalone without any pharmacology. So it is about your behavior, it is about cognition. So we have the solution. You have a lot of example in Germany with the DIGA. DIGA, you know, it is a digital act that allow app solution to be reimbursed for people. So it's going to arrive in France. And you have the era also of telemonitoring. You know that if you have a cancer and you are a better follow-up outside of the hospital, you have a better chance to get the right treatment in the right way. So you have a better clinical efficacy of your treatment. So we have plenty of digital solutions that are really coming in health with a lot of regulation, a lot of clinical control, etc. But I think we are facing an obligation of innovation in our field. And we can see that in France, I think the 2021 was the record in terms of fundraising for startup with €500 million that has been raised in 1 year for French startup. And I can tell you that it's good news for innovation.
Mm. Yeah, I also think there's no question that it's here to stay. You know, one of the reasons we ask ourselves that is because a lot of the regulations that were fairly restrictive, and I'll use telemedicine because it's an easy one to understand. Many countries in the world would allow for teleconsultation to happen, because unless a doctor is enabled by a certain law to consult virtually and to deliver a prescription virtually, then he cannot do it, right? So the laws were in place, but many restrictive rules existed, such as if you had not consulted that doctor physically once before, then you wouldn't be able to teleconsult. So during COVID, a lot of these restrictions, that was one of them, right, were lifted. And so many people thought that it would go back. But in fact, many of them are actually staying relaxed. So I think that's one of the reasons you're going to see, you know, sort of the numbers continue to sort of to rise. And as you rightly just said, Frank, out of need also, right? Because I talk about shortages in sort of lower and middle income countries, but many of our sort of more advanced countries also face what we call in France also the déserts médicaux, or the, I didn't realize how many health workers we had lost just in France. It's pretty scary. But anyway, in my field, there's also a lot of funding going towards digital health. There's no one that really talks, at least in global health circles, about health care sort of delivery or strengthening or improving health delivery without talking about data and with some sort of digital component, really. It's just a given now. And Frank, we are here with this fantastic Women in Tech event. What about the role of women in digital health? What do you think?
I think that just speaking about facts, more and more women are working in health. This is what you see in academic for to become HCPs. This is something there is really an attraction for women to work in the health space. And in my company, I did create some job position, and 70% of the candidates were women. So I did today have recruited only women in my team. What I can say is they are really focused. They are really entrepreneur. They are passionate by this. They were all passionate before coming in TechToMed in EARs and technology. There are some engineers, some are pharmacists with business schools, so have different profile. But I think really involved people want to innovate and to really have the ambition of to serve health and patient.
It's great to hear that you're having such a great experience, because I must say, for having looked at the numbers recently. They're just as dire as some of the numbers that we heard this morning, including from you, Sonia. And, I'll give you a couple of them. Women-led startups in 2019 only represented 14% of digital health deals that closed that year. Even in the US, only 2 of the top 10 digital health funding deals in 2021 were led by women. And same thing, 2021 actually constituted the record-breaking year of funding in digital health. And only 2% of the money went to companies that were led by women, as opposed to 82% that were led by men. So these numbers are not very good. So one of the things we're doing today is to tell you that this is a super exciting field, and anyone who's interested in health should think about it, this juncture of tech and health. This problem, sort of, that those numbers also have a lot to do with the overall gender equality in leadership positions in the health sector overall. There was a recent study that showed that there's only 15% of female CEOs in the sort of pharma and even health insurance company world. Whereas actually, despite the fact that 65% of workers in health overall are women. So there's many, many women in the health sector, just not enough of them at leadership levels. So there's a way to go. There's some true role models. You cited to me, Frank, the other day, some fantastic digital health ladies of startups that you knew of. And I know that in Africa, there's some unbelievable ladies also that have started some great. One of them is named actually in Nigeria also, Neka Mobison, who started a company called MDoc, which helps patients manage their chronic conditions, such as diabetes, for example. And then there's Daphne Ngunjiri, who created Access Afya in Kenya, which does sort of like virtual clinics in East Africa, and she's been also very successful. So what would you say, Frank, to the women, out there?
Health and technology is today in my country something really exploding, with a lot of job position, from engineer, CTO to CEO. And I think it's really a good momentum to if you are passionate to go in that field. There is a lot of opportunities, and I do see today that a lot of women are getting those opportunities. I have plenty of my clients in startups, in different organization ecosystems that are women. For example, in the French Digital Ministry of Health, it's fully managed by women today. There was a guy, Dominique Pont, but all the other people, they were women. So I think this is an attractive really area, combining entrepreneurship, passion, innovation, patient focus. So I think it's something it's a good momentum to come, to join.
Yeah, agreed. At DHP, it's 3 women, 3 passionate women entrepreneurs, and we have so much fun. And I think maybe what I want to add also is, after what we've gone through, this pandemic, this crisis, there's many, many of us, we constantly hear people looking for meaning, right? For a sense of why we're here and whatnot. And I can tell you that working on this access equation for better healthcare really feeds your soul. If that's one of the things that you're looking for, we just love what we do. Just feels like it makes a difference. It's not about the technology again only. It's a lot deeper than that. And there's another really interesting trend also, is that this digital world is bringing people to take better ownership of their health, and we're talking a lot more about prevention now, right? And that's quite a fascinating field, because there's so much to innovate on, like you said, so much to create still to have this better prevention. So that being said, Thank you very much for
Thank you.
your attention. Thank you for having us with you.